So this program we have been running for more than I think 2-3 years. So every Thursday we used to have this program. There are many participants who come regularly. Some people they don't come regularly because they go to some other programs in the community too. So they skip the some programs. There are communities like most of the people coming here, the Tamil community people, they come here, and Nepali recently this neighborhood has been more Nepali people, and there's another community Bengali and Somali, from some of the African countries. Those are the people who used to come, and not everybody is 65 plus, but some of them are 55 plus. Even the younger people, they used to come and they enjoy the exercise program. So most of them, even though they are immigrants, maybe they have been living here more than some people 15-20 years. So now they are grandparents or older parents, so the children go out and they are living alone in the apartment. So some of them, they need to pass their time, so they do their work in the morning. That's the reason we keep the program in the afternoon. So in the morning sometimes they do their domestic work, and some days they need to go to the temple, worship place, so this day that works for them very well. So, and this is close by, okay, so they don't have to, as the previous participant she mentioned, they don't have to walk too long, far away from this point. So same building, sometimes just passing 2-3 buildings, they can come. So those are the kind of thing they can easily come to this program. And especially in this program we have 2-3 languages. The staff, we speak different languages too, so it helps them a lot. Even though they don't speak English, it helps them a lot. Yeah, even the Nepali people, they don't even speak like Tamil people. So those kind of things it helps them, because we run some programs like even information sessions like diabetes, heart disease programs. So at that times we have translators so we can translate them in, so they get the information very well. I would say most of them have diabetes, and some of them have cholesterol, heart disease. It's few, but most of them have diabetes. So those are the issues. They talk more about diabetes and sugar, the food. Whenever we prepare any food or snack things, so we talk about more focused on diabetes and heart disease. Yeah, definitely, because that's what I told you. Sometimes we used to have sessions we talk about diabetic. We do presentations and give more information about diabetes and what to eat, what not to eat, and what is good for them, and that. So we run sessions like that too. So those are so more informative. When we make the snack or the food, so we tell them this is good for this is good for this one. So we used to we should have a complete plate, balanced plate in the diet. So we include veggie, all groups of what refer the Canadian food guide. So we encourage them to add all the food groups and give them information about all those things. But I would say not only this program, there's our social, and we used to, in our adult plus program, we used to have other, we take them, we have medical escorts and grocery and some of the support at home to some friendly visits. So that way it's very helpful for them. especially in the community, most of them, they don't know about this program, because they think about the cost, they have to pay, and so we have to do more outreach, and we used to do that and get people to know about this program. And we have been working with so many seniors, and that it's very helpful. We find that it's very helpful to them to be independent, like they don't have to sometimes some faces the transportation problem and stuff, so we used to refer them, because they don't know about how to reach them and where to go, and how to go, like thing. So we make the first referrals, like so they can we help them to get the services. So after that they will be like free. Sometimes we don't have to go with them too, but still they need the transport. Like we have some other services in the community who provide free or low cost transport, so we refer them, and by doing that, so that they get those benefits. One thing, the social, so they have they get a chance to meet each other, so they like to come to meet the people from different community. So that is one thing. And the time we have the social group, and the other home support things, many seniors, they need help with the medical appointments. So that way we we do a lot, like it's a very big thing that they need to go to medical appointments. Some for translation purpose, some for mobility and physical support. So those kind of things, it's very helpful. I would say, even though some seniors, they like to participate in the programs, but they are not willing to come out of the house. They don't want to, even though they like to do the exercise, but they don't want to come here at a specific time and all. And especially during winter, they don't want to do. During winter, we don't see much participants, because it's obvious, okay, you can't walk around this, and so those are the things that make them, isolation is definitely that's what I'm telling, where some people, they want to come, and some they don't, they don't have a chance to come and participate. Some even they want to come, they don't, how do I say, like, they don't want to come out. So that's the reason we do some friendly visits too. Like so when they see us, they are very happy to see us. Once in a while we go to them, or we call them. Every week, like we used to make a call. Even if we can't visit them, we used to make a call. Just to say hello. And sometimes, there are frail seniors. We had 2-3 times those kind of cases. Like one person, one senior, she fell down in the apartment, and every week we used to, one of our staff, we used to come to assist and we used to visit. But she fell on, I suppose, Monday or Tuesday, and after 2-3 days, after 2-3 days only, we came to know about that she was in the bathtub for 2-3 days, because nobody knows that, because nobody visited her, because maybe CCSC from a worker visits once a week, and one of our community assistant visits once a week. Like between those 2 days, she was in the bathtub for 2-3 days, and when our community assistant went there, she found that the same thing happened again, second time too. And what we did was, we made a lifeline, we connected her with the lifeline, but still after that she didn't want, because of another issue, like the credit card has been used by another, so something like that. She didn't want to have that, but again it happened, like after. So now we are working on a plan, like at least every day, like somebody can go, like the worker goes one day and we go one day, like, and the other day if some other people can go, the service provider, so like that, and one we can call her and see, so just to make sure that she's safe with the apartment. So those are the things we try here. So as long as they could, yeah, we have partnerships with other organizations too, like Region Park, because we have other programs too, healthy living, we have healthy living and job club, and 3-4 different programs in the community matters. Okay, so basic thing is neighbors helping neighbors is our main. So we have other programs too. So for that, for the healthy living project, we have partnership with Region Park. One dietitian every week. One day a week she comes and she can meet the community members. They can meet her to talk about, and she will come and do a session too, like on various topics like food, the chronic diseases and stuff like that. She come and do a session. So we invite participants, or they can come and meet her personally, like to talk about their food and stuff. So likewise we have partnership with other organizations too.
And would you say generally that they're useful, those?
Yeah, definitely. And we have another program at 55 Blaker, where so we have two Tuesdays now from this month. It's 2 Tuesdays a month. We run a seniors coffee. It's called Coffee Lobby Party. Okay, so we used to run the program there. We go from here, and CRCT, they are also part of that, and the supportive housing. So they run we run the program together.
Okay.
We used to have a coffee lobby party, so we call people, and every session we organize some information session, like so next week, next time we are going to have a dental hygiene, oral hygiene session. So two of our in the community, from the community itself, we have a dental hygienist, which is an immigrant, and so we take them and they do a session, like just to provide information to seniors about the oral health and oral hygiene. Yeah, especially in this community, I would say the language barrier is one thing. There are people from different communities, they don't speak English properly, so they find very difficult to to access the health system. So they need they can't be independent, like even if they are physically fit, but the language barrier doesn't allow them to go independently to access the healthcare system. So that is one of the main thing, I would say, for seniors.
And do most of them seem to have a doctor?
They have a doctor, but they have a doctor, like in this community, Tamil speaking community, speaking people, there are a lot of, and there are only one doctor in the community who speak Tamil, so they go to them, and most of them go to the Tamil speaking doctor, and some of them have different family doctor too. Some of them they don't have a doctor too. Very few people, and when they go to specialist, so definitely they will need help in the translation. Even though if they have a family doctor, they would like to have a family doctor who speaks their own language. Each community, especially the seniors, because they want to tell everything about their health. Okay, whatever the pain they have, they'll be happy to talk about their own health, okay, rather than speak another person speaking on behalf of them. So, but it's hard to find all the communities, because one or two, because this is the immigrant area. Okay, this is a very concentrated